phase that we're in with COVID now?
Well, as you know, just a couple of days ago, the United States declared the end of the public health emergency, and on May 5th, WHO did the same thing. But I think it's important to point out that although the emergency is ended, we are still not completely out of the woods with COVID-19. We're still averaging about 150 deaths per day, which if you do the math on that, that's a substantial number of deaths. And so although when you compare, for example, a year and a half, 2 years ago, we were having 800 to 900,000 infections a day and 3,000 to 4,000 deaths. So we're way down to 150, but that's still an unacceptably high level. The reason I say that is that everybody wants to, and we do all should, really begin to get back to normal life, get ourselves. You see now we're in a room here, not everybody's wearing a mask given the level of infections. That's appropriate, but there are still vulnerabilities in society, particularly people like the elderly and those who have underlying medical conditions and those who are immune compromised, who continue have to be careful of it. So bottom line, short answer is it's not over in the sense of totally behind us, but the emergency nature of it certainly is behind us.
Dr. Fauci, is there a specific metric? I mean, you just talked about the daily deaths, but I spoke with Dr. Kanika Cunningham with the St. Louis County Department of Public Health last week, and she's saying that the metrics still don't signal the end of the pandemic. I know you're just saying the emergency.
I just said that, yeah. Yeah.
When do we say the pandemic is over?
That's a great question. And I actually wrote years ago a paper on what the heck is the definition of a pandemic. And it really, people have different definitions. A pandemic is mostly an infectious disease which is pervasive throughout the world. So when you talk about pandemics, there's the accelerated stage of a pandemic. When you still have a pervasive illness throughout the world, technically speaking, it's still a pandemic, but it is not at the accelerated stage. For example, if you look at HIV, like right now, HIV has been 40 plus years. Is it still a pandemic? Strictly speaking, it is, because it's pervasive throughout the world. But the level of infections, particularly in the United States, have gone down considerably, but there's still enough to call it a pandemic. But it isn't like it was in the early 1980s when you had 40 to 50% of the gay men in New York City and in the Castro district were infected. That was very different than what it is now. So it really is depending on what your precise definition of a pandemic is. Strictly speaking, we still are in a pandemic, but not in the accelerated emergent stage of it.
Hey, doctor, congrats on your continuing education, the degree, I suppose. I don't know. Anyway, how satisfied are you with the postmortem from Congress or from the states after the pandemic? What should they be doing to do whatever we can to prevent another pandemic like the one we had?
Well, there's a lot. I mean, I recently wrote a paper in the Journal of Infectious Diseases in April of this year, just last month, called Lessons Learned from the Pandemic. And you know that there's a treatise, a book that came out, is Lessons from the COVID War, by a group of 34 individuals who've looked at it. And the reason I'm answering the question that way is that there are a lot of things one can do to be prepared for the next pandemic. There were many things that we did right, and there are certain things that we need to do better. One of the things that we did, I believe, quite well was the scientific response. And by the scientific response, I mean doing in an unprecedentedly speedy way, getting a vaccine from the day we knew about this new virus was January 10th, 2020. 11 months later, we had in the arms of individuals a vaccine that was safe and 94 to 95% effective in preventing significant clinical disease. That time frame saved millions of lives, without a doubt, incontrovertible. No one can argue with that. The reason I say that is that under most normal circumstances, it would have taken several years to get the vaccine. We got it in 11 months. So one of the things we learn, continue to make investments in basic and clinical biomedical research to allow us to be scientifically prepared. The next bucket of preparedness and response is the public health preparedness and response. And we did not do as well as we should have. In fact, we were judged by the Johns Hopkins School of Public Health as being the best prepared country in the world for a pandemic. And yet we had 1.13 million deaths, which is about as high or higher than any other country. So there are a lot of things that we need to self-examine about how at the local public health level we responded. We had a bit, as you know, of a disparate response in this country. We had people who denied the fact that vaccines worked, people who were actually anti-vaccine. There were people who felt masks were not necessary when we know they clearly are clearly effective in saving lives and preventing people from getting infected. So we've got to bolster up our public health preparedness and response. The CDC, to their credit, has re-looked now at how they've responded and realized that they could do a lot better in getting information in real time out to the public health implementers in order to respond. And I think that's very good because there's been a lot of criticism about what they've done, but now they're realizing it and looking inward about how they can improve it. So those are all the things you want to do for the next pandemic.
On
Sir,
that,
Dr. Fauci.
when it comes to the political divisiveness and the social divisiveness as it relates to some of the things you talked about, vaccination and masking, when you compare what we've experienced in the COVID pandemic to what you experienced from a criticism and pushback from the AIDS HIV
Right.
epidemic, what has changed in all these years, and are we at a point of no return?
Well, I don't know. I never say we're at a point of no return because I'm a cautious optimist in the better angels in our society, which I hope reemerge altogether, which is, kind of tough right now. Comparing the pushback from the activist community during the HIV/AIDS outbreak in the early years of '80s to the divisiveness we have now is comparing apples and watermelons. It's totally different because the AIDS activists were trying to get the attention of federal authorities like myself, scientists and regulators like the FDA to appreciate that the nature of that outbreak and the way we were responding to it was in a very rigid way. Rigid inclusion and exclusion criteria in clinical trials, rigidity in the approval process of drugs, where people had a disease where they were dying a few months after they became clinically apparently ill. What they were doing was trying to gain our attention. Once they gained our attention, what they were saying made absolutely perfect sense. And we learned from them, and we did a better job by listening to what they had to say. So it was a attention-getting, confrontative way of getting us to understand their side of it. And their side of it was a noble side. What you're seeing right now, I don't need to tell the press this, is profound divisiveness, ad hominems, conspiracy theories, and mischaracterization of the science. That is not helpful when you're dealing with a public health crisis, because that kind of thing is the enemy of public health. And in fact, probably those kinds of things that dissuaded people from getting vaccinated almost certainly caused the loss of life that was avoidable. So there's a big difference. One was trying to save lives, and another was doing something that inadvertently, I don't think deliberately, but inadvertently, was causing the loss of life.
Doctor?
Sir, I was wondering, you're addressing graduates today, and you have a lot of experience with the intersection of the political and the medical. What advice do you have for them today about balancing those, especially when you're in medicine, you think that you
Right.
might be able to exist outside of politics, and it's very
Sure.
clear that that's not the case.
Are you going to come to my address or not?
I would like to. I don't know if I'm able to. I hope it's streaming.
Yeah, well,
Okay, I'll
it
watch
likely will be. So actually, that's a really good question. And one of the points that I'm making to the audience is that we are living, as I'm alluding to one of the questions here, in an arena of what I call the normalization of untruths. And you don't need me to say this. You just need to look at what's going on in society. People are saying things. I'm not naming who these people are, but people are saying things that are egregiously untrue. And everybody knows it's untrue, but they say it so often that it becomes normalized. In other words, by normalized, I mean you shrug your shoulders and say, that's the way it is. What I'm telling the students who are going to be physicians, whose discipline is built on science and truth and evidence, that they should not sit back and accept the normalization of untruths. It's their responsibility to push back on the normalization of untruths and say, no, wait a minute, that's not true. We're not going to sit down and give you equal credence to what you're saying if what you're saying is egregiously untrue. And that's what I think we all need to do, not only medical students. I mean, they have to do it because their career is built on science. But when you have essentially the invalidation of science, it's a very, very slippery slope.
I don't know if you would draw a contrast to immune response to misinformation, but you can't just retreat from it. Some
Right.
people think you have to confront it. So when you consider a free society that places such a high value on free speech, how should the scientific and
Right.
medical communities
Sure.
go about re-engaging the misinformation?
Well, by coming out and being very active in speaking about truthful things based on evidence and data. It appears all you need to do is to go to social media, that the people who are spouting a distortion of truth appear to be really energetic about it. And the people who have the capability of spreading valid evidence-based information, as I say somewhat tongue-in-cheek, usually have a day job that they need to worry about and don't spend a lot of time on social media spouting things that are egregiously untrue. So what I encourage people in medical school or people beyond professional school or college is to don't be shy about going out there and speaking and promoting the things that are evidence-based and truthful, because you've got to counter it. You can't give them an open field and surrender.
Talk about the way that you have been personally demonized through this last 3-year period, the effect that it's had on you and your family, and your characterization of that.
Well, it's been, I would say, unusual, isn't it? That someone who is a public health official and a scientist who for the last 38 years that I've been director of the National Institute of Allergy and Infectious Diseases have probably, not judged by me, by others, probably resulted in the saving of millions and millions of lives throughout the country and the world. And likely because during a period of time, I stood up against untruths when I was in the White House and Trump was saying that the virus was going to go away like magic tomorrow when we knew it wasn't. I did not take any great pleasure in contradicting the President of the United States. I have a profound degree of respect for the office of presidency of the United States. But I had to speak up when they were saying hydroxychloroquine works like magic, ivermectin works like magic, and this virus is going to disappear tomorrow. I had to say, no, that's not true. But that launched an extraordinary amount of hostility on the part of the far right against me, where I became sort of public enemy number one for QAnon and the far right and all the other radicals. And, you know, it's very easy to personify an individual. I mean, to say we disagree with this concept doesn't have any oof to it. But when you demonize somebody, you could have a face there and say, you know, I mean, we had people, as you know, who were running incumbents on those who were running for office who had no idea who I was and still don't. But they ran on the ticket, fire Fauci or put Fauci in jail. That's almost kind of weird, isn't that? Yeah, I would say so. Yeah.
As a follow-up to that, sorry, go ahead.
You talked with the New York Times' David Wallace-Wells on this topic of communication.
Yeah.
And you said, particularly with how COVID would affect seniors, how loud do you have to say something for people to understand? How often do you have to say it? Do you feel like today's graduating class, is communication an issue of volume and frequency, or is there something else that today's young doctors need to learn to effectively communicate medical information to the public?
I don't think they need to be loud about it. They just need to do it. I mean, did you see the class when he said, okay, everybody with a degree of yada yada, all these beautiful people stood up and started waving their flags. All they need to do is speak up. They don't need to, you know, get overkinetic about it. Just do it.
You also said that there would be value in taking a moment now to try to listen to people who pushed back against the public health advice during the pandemic. Can you expand on that?
Yeah, because even though I'm considered public enemy number one among some radical people, I don't consider them Fauci enemy number one. I always have in my entire career leave an open mind that even when people criticize you in a profoundly unfair way, that there's always some kernel of I wouldn't say necessarily truth, but probably something in there that you need to listen to. Because what's motivating a lot of the pushback is that people are either hurt or offended by something. And you've got to ask, is that a valid point they have? Even though they may be 95% incorrect in something, are they 5% correct there that you could learn something from them and reach out to them? So I don't demonize the people who demonize me. I always look to see, is there something there, some message that they have for me that I could actually learn from? That's what I meant by that.
Idea what that message could be for those people who are maybe not the kernel of truth. But
Well, because they can't all be that bad. They can't be. I mean, they may be saying things that sound, very aggressive and offensive, but it's impossible that they're all that bad. They're not. I mean, they may be acting in a way that puts you aback, but there is something there that I think is redeemable.
Dr. Fauci, we talk about the divisiveness throughout the country. There's an example of that happening today, that there's going to be a couple protests because of your arrival here at Washington University, and they're citing 3 medical experts that have science that counters what you and the country have gone through the last 3 years. What's the science they could possibly have that would counter the life-saving
In science, in medicine, in any discipline, you could always have a couple of people out of several hundreds to 1,000 who would say something to counter what you're trying to say. So, I mean, I could have 1,000 people who in good faith say, you take this medicine, you take this vaccine, and it will save your life. Somewhere, somehow, somebody's going to find 3 people that say vaccines turn you into an ostrich, or, Fauci and Bill Gates put chips in the vaccine to make you magnetized to a refrigerator or something. But you're always going to find that. The thing you have to be careful of is what I call false equivalency. And false equivalency is the equivalency of experts. So you have somebody that says vaccines are good, antivirals are good, mask is good, ventilation is good. And then you have somebody else who has a doctorate somewhere that says the virus doesn't exist, it's a hoax, go out, get infected, it shouldn't kill anybody. And the general public sometimes understandably say, well, wait a minute, this guy's a doctor, he says this. This guy's a doctor, he says this. How am I supposed to know who's right? Well, because there are about 10,000 people who are saying this, and there may be 5 people who are saying that. And the mistake we make is we make these falsely equivalent. And that's what you mean by false equivalency. Just because someone has a credential doesn't mean that they're right. You've got to look at the broad consensus in the scientific community.
Pew Research identified the United States as the most politically divided nation on this issue of COVID. I couldn't help but notice that countries that had political unity, Sweden, Singapore, were widely measured to have a better response. I don't know how you think about that. You mentioned political candidates a minute ago. Ron DeSantis is running for president right now, saying in Florida they put freedom over Fauciism. He's using this rhetoric to say that you represent government control, he represents freedom. How should voters think about rhetoric like that going into 2024?
Well, I don't want to get into the political arena because I've always said that I'm not a politician. I'm not a Republican. I'm not a Democrat. I don't get involved in political discussions. But if you look at the facts, they don't match what that individual is saying. I mean, does anybody really think that I am controlling someone's thought process? I mean, would that I had so much power, but I don't. So.
But to the extent that political unity and buy-in, public buy-in, actually helps the public health.
Well, the yes and no, and let me tell you why. Political unity, be careful. political divisiveness is antithetical to a good public health response but you don't have to have political unity. I mean, one of the beauties of our country is the diversity of everything in our country. You know, you have some people who are far right, some people conservative, some people center, some people left, some people very progressive. In the right circumstances, that leads to the beauty of our country because we have something for everyone there. But when that turns into divisiveness, that's when public health suffers. So even though countries may seem uniform in what they're doing, in that they may not necessarily be politically unified, but they're unified in their purpose of saying, this is the right thing to do. And many of the countries were able to do that.
Doctor, a two-parter.
One more, so this is the last question.
A two-parter on that. Part one, what do you see your legacy with the federal government? And part two is, what are you looking forward to now that you have a little more time on your plate?
Well, I mean, I let legacy be determined by others. But if you were to re-ask the question of what am I most proud of what I've done, and again, like I said, legacy will be determined by people who follow me. There are 3 hats that I've worn in my 54-year career at the NIH, 38 years of which I was the director of the National Institute of Allergy and Infectious Disease. My first hat was as a scientist, both a basic and clinical scientist, who was involved in a number of studies that actually resulted in the saving of a considerable number of lives, the development of therapies for autoimmune diseases that were incurable. This is way before HIV, long before you were born, that's for sure. That's what I did as a scientist. And then when HIV came along, I did not a little bit, but a lot of work on delineating the nature of the disease. As the director of the Institute, I established the AIDS program, which now, over a period of 40 years, is responsible, together with the pharmaceutical industry, with developing the whole array of drugs, which has resulted in the saving of millions of lives. And that I feel good about. And the last thing is, as a policy person, I had the opportunity and the privilege of advising 7 presidents of the United States. And I could tell you a story about each of them, but the one that I think stands out the most is when President George W. Bush tasked me and asked me to go to Africa to put together a program that would be transforming and accountable, that could save the lives of people in the developing world that don't have access to treatment and prevention. And I did that. I went to Africa and I put together, over a period of about 8 months, a program which we call the President's Emergency Plan for AIDS Relief, or PEPFAR. And we had the 20th anniversary of that with President George W. Bush, who came back to Washington to have a little group of us that were involved in that. And we celebrated the 20th anniversary, and the estimate is that that program has saved 25 million lives in the developing world. That I feel pretty good about. So again, others will judge what they think of that, but from my own standpoint, that's what I feel good about.
What do you look forward to?
We're done.
That's done. Sorry. Oh, wait, he didn't get to finish what he was.
It's the second
That was
question.
part of my question.
Yeah, okay. What do I look forward to? No, actually, what I look forward to is sort of some of the things I'm doing right now. Is that I'm retired from the federal government, but I'm not actually retired in the classic sense. I don't think you're going to find me on a golf course at all, or at a bar having a martini. I'm going to be probably out there doing what I'm doing, teaching and speaking and writing for the purpose of inspiring the younger generation of people to go into science and perhaps even to consider a career in public service, which I think is a high calling. Not everybody is going to want to go into public service, but for those who have a tendency of wanting to do that, I would like to maybe serve my life as an example of what can be accomplished. So that's what I'm looking forward in the future.